So, imagine you are at workplace and someone calls you saying a family member just had an accident, but there are no doctors to attend her or him. What will you think in that moment, or what will you do? You are losing someone and no one can help. Assalamualaikum and greeting to everyone. My name is Roshazani Najiha binti Muhammad Rosli from class ELC590, and today I would like to share a little bit of the information about ICT used for healthcare. I would definitely feel devastated, hopeless, scared, sad, almost even useless. Horrible, right? Well, there are people around the world that face situations like those very often. Many people in the lower class do not have any sort of medical care due to their economic situation. Do you see how not having access to medical care can be dangerous? That is why we want to fix it. We must focus on its current status and statistic, moral and ethical problems, the solution and the benefit of fixing this problem. Information and Communication Technology or ICT has revolutionized the healthcare sector in recent years. ICT has made it possible to store, share and manage patient data more effectively. It has also enhanced communication between healthcare professionals and patients. The use of ICT in healthcare has led to better patient care and improved clinical outcomes. It has also helped to reduce the cost of healthcare delivery. There's a little evidence on the benefits of technology for healthcare aids. Benefits of ICT are described as tangible or perceived outcomes derived from the implementation or adaptation of ICT. The benefits of using new ICT are usually described with a great positivity. A clear description of the benefits of ICT for healthcare aids can inform the decision-making process regarding the implementation and adaptation of new technology for healthcare aids. The evidence suggests the benefits related to ICT for healthcare aids are consistent between different healthcare professionals. These benefits are related to improvements in documentation, monitoring, and quality of care and support to existing workflows and information exchange. Also, enhancement in communications. First evidence is improvements in communication. This is compared with conventional methods such as fax, traditional mailing, and telephone was a consistently reported benefit of ICT for healthcare aids. ICT also can improve communication between caregivers, patients, and staff by introducing tools such as video calls and telehealth. I observe healthcare as opportunity to provide services in distant places. For example, ICT can support healthcare aids to deliver high-quality healthcare in remote territories and regions in rural communities and isolated population. The need for telehealth service for older adults, especially those living with dementia, has increased over the last few years. A few authors has described how telehealth can improve healthcare service delivery. Next, improve access to information and documentation. This proven when accessibility to information and documentation as an enormous benefit by providing healthcare aids quick access or real-time updates to their clients' information. A significant group of studies reported that ICT improved documentation quality and efficiency by improving consistency in documentation with more precise and updated information. Despite challenges that ICT can improve healthcare aids workflow and quality of care for their clients, the main issue we experienced was the scarce literature related specifically to healthcare aids. I understand that the barriers and potential benefits of ICT adoption for healthcare aids. Future direction should examine the impact of the ICT on workflows of healthcare aids. I recognize the need for more straightforward ICT aligned with healthcare aids workflows. In addition, we must consider the involvement of end users in design, training, and education and clarity about the use of ICT. The voice of the end user is essential for developing ICT tools. Future developments should include feedback from users in every step of development and the mindset of improving care. This could be done in participatory design methods to engage users in the ICT. The novel coronavirus disease 2019 or COVID-19 pandemic has accelerated the adoption of ICT tools such as telehealth application. These applications include remote consultation for seniors, specifically persons living with dementia, to minimize the risk of contracting COVID-19. The pandemic has impacted the role of healthcare aides as caregivers by limiting their interaction and communication with their clients and family, as well as it has revealed limitations in their ability to provide remote services. This is considering the gaps between different healthcare facilities and their preparedness to provide telehealth services with patients who have no internet connection or phone service. At the same time, the pandemic revealed opportunities for the adoption and implementation of ICT tools to monitoring COVID-19 symptoms and coordinating and delivering care. In the upcoming years, I can expect a greater demand, adoption, and use of ICT to improve and enable the quality of care. Identify the healthcare aids needs and requirements for design is crucial as they will pave the road of acceptance and adoption of ICT. I believe that critical social culture factors needs to be understood before developing ICT. In the future, healthcare aides with technical training may be more receptive to ICT. This could help healthcare aides to overcome multiple barriers identified. One of the bigger risks associated with ICT in healthcare is the potential for data breaches, with sensitive patient data being stored on electronic systems. There is a greater risk of this data being accessed by unauthorized individuals. This could lead to patient confidential information being leaked, which could have a devastating impact on their lives. Finally, ICT can also lead to a more sedentary lifestyle for healthcare professionals. With many tasks now able to be carried out electronically, there is a less need for staff to be physically active. This could lead to health problems in the long run, such as obesity and musculoskeletal disorder. Despite the risk, ICT has the potential to transform healthcare for the better. When used correctly, it can help to improve patient care and make healthcare organizations more efficient.